Now, Limpopo's Health MEC, Dr. Phophi Ramathuba, and MEC for Transport and Safety, Mavungo Ramakanya, are in Elim, north of the province, visiting the hospital there. This is part of a series of visits to hospitals by government officials to ensure the establishments are ready to treat coronavirus patients. Our reporter, Hitekani Magwedze, is at the hospital and joins us live. Good morning, Hitekani. Why is the Elim Hospital significant in Limpopo's fight against coronavirus?
Apart from the fact that I was born at this hospital, the fact is this is one of the oldest hospitals in Limpopo, and certainly in the country, first established in 1899 by the Swiss, and it's continued to serve one of the poorest provinces in the country quite well at that. But along the years, it's dilapidated, and the size of it and the impact that it had in serving rural communities has really dwindled. And certainly in the fight against coronavirus, there is a need for such establishments, especially those who are placed within the rural communities and rural or remote areas where resources are really a challenge. An establishment such as this is important to make sure that it is functioning to its best capacity, and that's what the MECs are here for, to make sure that this hospital is ready and it can be the kind of beam or light that it was in the recent years, especially at a time like this.
You mentioned the rural communities, at this time and the access to that hospital. What are some of the challenges that rural community members are facing when it comes to accessing that hospital?
Well, look, across the world, and maybe definitely across the world, and definitely in South Africa as well, the coronavirus has made sure that it exposes the weak links or the weaknesses of governments across the world, from inequality to poverty, but certainly to the access of good resourceful or resources at hospitals. And like I said, this is one of the hospitals that has been left to dilapidate by government, and there's no way better to say it. It has not been kept up to the standard at which it was before. So this coronavirus now stands to highlight the weaknesses of government, especially where rural communities are meant to access the kind of resources or the kind of the standard of health that is expected from a health facility at a time like this. But it's not only the virus has not only exposed the challenges or the weaknesses of the health system in South Africa, but certainly, especially in the rural areas, there are challenges of the access of water, for example, and how we know that government has made efforts to buy off all tanks and distribute them among rural communities. But the fact is, because of those years of a lack of development, a lack of pipes, a lack of proper housing, a lack of proper health facilities, right now those challenges are magnified. You have people having to stand in long queues or huddle up in groups in waiting for water at water tanks around Limpopo, around the rural areas, and it defeats the purpose, really. The situation is supposed to be that people are staying at home. When they're sick, they're able to go to proper facilities, but it's not the case because they are in the more rural areas, which makes the fight against coronavirus here in the province a pretty unique one for the provincial health departments, and certainly the other departments that are coordinated with to fight against, because of those weaknesses and elements that have been brought on by years and years of a lack of development in the province.
And very lastly, as Limpopo Health and Community MEC Dr. Phophi Ramathuba visits that hospital today, what is she hoping to do there, and perhaps what sort of impact will she have as she visits and observes?
Well, Paul, we spoke to some of the nurses and some of the staff here just to get a sense of how things are going. And the challenge is that, you know, to the most meager type of assistance, such as sanitation, sanitizers and masks, those are here, but they are in pretty small supply. So there's a hope that the MEC's visit today will make her realize that there's a need for higher numbers of these protective clothing to ensure that nurses are protected. You'd remember that across the country there is a cry and a plead from the health sector for the government to provide a bit more protective clothing, from masks and gloves and sanitizers. And there's certainly that kind of plead and outcry from this facility as well. She's going to check for compliance firstly to make sure that the staff are protected, because those are the people that you need to be protected to sustain their protection so that they're able to provide for the kind of assistance that they're supposed to. But it's also to check for beds, those ICU beds that are needed to, deal with patients who are critical from the coronavirus. There's a need to ensure that there's enough beds, there's enough ventilators, and where there's a shortage, that the MEC notes that and hopefully endeavors to meet that need here, so that people don't fall short and have to drive another 120 plus kilometers to Polokwane, where there are a bit better facilities compared to where we are right now.
All right, let's leave it there for now. We will continue, of course, to bring you the very latest from what's happening on the ground. Our reporter, Hitekani Magwedze, stationed in Limpopo, just observing the impact of coronavirus, as well as speaking ahead of Limpopo MEC for Health, Dr. Phophi Ramathuba, who will be visiting the Elim Hospital. We'll take you there as soon as that process is underway.